Hey everyone, in this week's Thrive in 5, I just wanted to give you a quick synopsis of what can happen in your rib cage that might create some unwanted symptoms for you and certainly can be addressed by a chiropractor. Now, in your rib cage, you have 12 vertebrae, you have 12 ribs. The vertebrae in your low back look like this. These are some lumbar joints. The vertebrae in your mid back, your thoracic spine, look very similar. However, they have another different attachment point where your ribs will come around and fit in there perfectly. Obviously, our ribs expand and contract. When we breathe, our ribs give us a great structure. They also protect the vital organs, your heart and your lungs. But there are some activities that can create strain with some of the muscles around the rib cage. Your diaphragm can become irritated at times. And sometimes if you're dealing with digestive upset, you can have irritation from your esophagus or your stomach that refers some changes to the mechanics of your rib cage and your upper back area there too. So, if you're dealing with some of these challenges, if you're dealing with any kind of shortness of breath, sometimes you get an acute sort of pain when you take an inhale, or you just feel like you can't really breathe, easily and effectively. It's worth checking in with a chiropractor. Now, certainly there are lots of situations where you need to head to the emergency room if you're having some shortness of breath. But if this is something that kind of comes and goes, if it is something that happens when you're doing certain activities, you might want to just check in with your chiropractor for an opinion. And your chiropractor can certainly then diagnose what's happening and then obviously send you for appropriate care if there is something going on with your cardiovascular system. But keep in mind, a lot of people mistakenly feel that there is problems with their heart and their lungs that is actually just coming from a slight subluxation of the rib where it attaches to these thoracic vertebrae. And when we gently align them and put them back into place, the pain drops immediately, you can breathe nice and easy again, and it just restores, proper mobility mechanics. So just a quick reminder for you, if you're dealing with some of those symptoms, check in with your chiropractor. It could easily avoid an unwanted long trip to the hospital or to your doctor's office because it might be something that's easily fixed with some mechanical work with your chiropractor, even some active release, sometimes just some massage. But certainly rib pain is something that we deal with all the time. It's really easy for us to adjust, and the results are outstanding. Hope this helps you this week. See you soon.